notebook. I'm not Steve, but I am going to use my handy dandy dry erase board. So we're talking about substance use disorder. So let me explain to you the way it was explained to me by Dr. Lukianova. She was in my residency. She was a supervisor of at the time, I think it was called the Drug and Alcohol Program. But first of all, you can have addictions to just about anything, okay? Or a dependence. And that's the way that we put it in our book now. But it used to be called an addiction, drug abuse, substance use. And now we think about it a little bit differently. We will use the term dependence because that means that the body either has a physiological withdrawal or tolerance to it, or a psychological dependency, meaning, that you have a withdrawal or an intolerance or tolerance to it. So let me show you basically right here what I'm talking about. So every creature that is alive wants and needs at least three basic things. Okay. And those things trump everything else. So on the meter of life and balance, if I have my little scale here, food, sex, and for the most part, things like shelter. If you look at the hierarchy, Maslow's hierarchy of needs, you're going to see these up there. Every creature needs these things. Okay. Now, sex, we're going to pause on that one for a moment because you can't have a sexual addiction. You can't have food addiction. And I guess you can have an addiction where you want bigger and better always, like if a person has a wealth, addiction, which we don't have a name for that yet, but it probably falls in an NOS, which is not otherwise specified category. But for the most part, just thinking neurotypical, normal biological processes, you need food to eat, to stay alive. Okay. You need sex to procreate. If you want your progeny, you want your line to go forward, you want a legacy, you need to have sex and procreate, have babies. And then you need some form of shelter. I want you to think, if you're on you were in a car accident or a plane crash and you're on the side of a mountain, this is what you're thinking about. How do I get food? How do I get shelter? You may not be thinking about sex, but you're thinking about making your body last, okay? And for long-term progeny, you're thinking about these things. So other stuff, you may dabble with certain drugs. You may dabble with tobacco. You may dabble, I don't know, let's think. You may dabble with alcohol. And I'm not going to keep writing alcohol, ETOH, okay? You may dabble with alcohol. Your dabbling is not going to take over these things with a normal structure of the brain. So no genetic predisposition, meaning your granddaddy wasn't an alcoholic, your grandfather wasn't an alcoholic, your dad wasn't an alcoholic, your mom was an alcoholic. No genetic predisposition. You may drink alcohol and it doesn't cause everything to topple over. Okay. You may smoke once or twice tobacco, cannabis, right? You may smoke a little bit once or twice or whatever, and there's no addiction. There's no longing, lasting need to continue this. It stays in its place, and all the priorities are there. And let's say we don't use sex as just sex. Let's say we say sex and then also relationship. So my board's getting a little messy here. That's why we use dry erase board. So let's say we don't say sex. We say food, we say relationship, and we say shelter, right? Because let's say you're on that plane in the middle of wherever, as long as you got another person, for the most part, you're going to do okay. Think about the story. I think it was called, it's not Lost. It's the movie with Tom Hanks. The ball's name was Wilson, where he basically was lost at sea on an island. He created relationship. He made the ball his friend to the point when he was getting ready to leave the island and the ball meandered away. He literally was going to leave his boat to go and get Wilson because that's how much he needed socialization and relationship. Okay. It is innate. We were created to have this. Now, what happens when the balance starts swaying? You get that drug, you get that whatever, and everything looks basically the same. Or what happens when this isn't as important? Now this is the heavy beast. This is the heavy load. It doesn't matter about food, relationship, shelter. I'm now tolerant to this medicine. I need more and more and more. I'm withdrawing from the medicine. I get really ill. I get really sick if I don't have this drug, this tobacco. I get irritable if I don't have my smoke. I'm ready to curse you out, curse everybody else out if I can't afford to smoke. I need that alcohol to wake up in the morning. I have a positive cage. I can't, people have told me I need to cut back. They're annoyed with my drinking or my whatever. I feel guilty about people annoying me about my drinking. And I need an eye opener. Let's say all the things are there. Okay. So if I've got this going on in my life, sorry for the IG people, I got this going on in my life. Food, clothing, shelter, relationships don't matter as much. First of all, sex went out the window, unless sex is your thing. That went out the window. Food, how many people have you seen that have substance use issues and they're like skinny as stink, right? They're emaciated because the heroin addiction or the cocaine addiction or the opiate addiction or the whatever. They don't want to eat. They've got bills due because they didn't go to work because they're eating and drinking and doing whatever, and they're not doing the things they need to do. And then relationship problems come in. You're stealing from your mom, you're stealing from your auntie, you're stealing from whoever, and you're starting to burn bridges. Does any of this sound familiar? If it does, you could have a substance use disorder. You could have anything can be a substance use disorder. So let me start telling you that in your brain, what I just showed you actually happens, because before, things like food, relationship, and stuff, those are the heavy dopamine drivers. But over time, it flips so that these other things, the drug becomes a heavy dopamine. So then you've got dopamine chasing. Sound familiar to anybody? You're chasing that dopamine high. You're chasing the first high. Okay, and again, time out for thinking it's just opioids and all kinds of other stuff. Okay, it can be. Let's talk about the ones that I listed. It can be sex. It can be food. Ever heard of bed or binge eating disorder? We don't put it under the addiction category, but there is Food Addicts Anonymous. There are Narcotics Anonymous. There are Gamblers Anonymous for people that are gambling. Okay, that's why anytime you see gambling casinos, otherwise they've got the little sign or advertisement that says, hey, if gambling's a problem for you, call this number so we can get you help. There are Sex Addicts Anonymous. Okay, if there's an anonymous for it, then that means that basically they're considering that there is an addiction. Okay, what do you do about it? Well, I think there are at least 3 prongs. I've already told you one of them. First thing is recognizing that you've got an issue, right? Recognizing that food and relationships and housing don't matter to you as much as whatever this is. They matter, but let's be real, they don't matter as much. Let's just be real. So, like I said, there is an anonymous for everything. So I'm going to write down all the things and I'm going to turn it to the side for my IG people. You're welcome. First is, of course, after the awareness and the acknowledgement, you need support, which means that you're probably going to have to disclose to somebody that this is an issue. This is an issue for you. All right, I see FedEx person coming, so I may have to go out because I think there's only 1 or 2 of us in the office right now. You need support. So whether it is an Addicts Anonymous, great place to start. Does not have to be in person. I have seen people who are high level that are like, I can't go to an NA because if somebody knew that I had a narcotics issue, I could lose my job. Okay, they've got them online. They've got old YouTube videos that you can listen to and watch. No excuse. There's really no excuse, okay, to get support. The people that are within your home, they can help you with support and accountability. I am always a big believer in having a sponsor, someone who is outside of your home, your wife, your sister, your son. They can be your sponsor, okay? Because likely they don't have the same addiction that you do or the same issue, substance use dependence that you do, and they're not going to hold you accountable. Yes, they can be support, but they can't. They are also often codependent on other things, including you, and they can also enable. We don't want them to enable you. You got drunk last night and you didn't show up for work. They should be able to say, well, he got drunk last night and he's not coming to work today, and let you take the consequences. But they're probably not going to do that because they like light and heat and food. And if your job is the main job, they don't want you to lose it. So they will lie for you. Oh, he's sick. You're not sick. Intoxicated or inebriated or hungover. You're not sick. You do have a sickness. It's called addiction or dependence. But you're not the same level sick as having, flu or something. First thing, accountability. Second thing, in terms of support, but not your family and not your coach or your accountability mentor, you may need, dun, 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 you might need a medicine. Okay. This is not scary. This is not, oh my gosh, I'm going to be on this medicine for the rest of my life. You could, but you don't necessarily have to be. Some people get on a medicine to help wean. Key ones, buprenorphine. Yes, we are prescribers of buprenorphine here at Let Life. But buprenorphine is a great one for opioids. So if a person's been started out using Percocet or oxycodone or whatever for your surgery or for your football injury, and you're still using it and you're getting people to prescribe it for you, you're a physician and you're prescribing for yourself. No. And you got a dependence issue, you can get on a medicine to help. Buprenorphine is a great one. Here we prescribe it alongside of other medications to make sure that you're doing okay. You do have to come in person the first time to get your treatment. It's usually a 4-hour process, but then after that, every month you're just checking in. Yes, you can check in virtually. Sometimes, yes, we will call you and do random urines just to make sure you're not doing anything that you shouldn't, because, overdose is real. We're going to give you the buprenorphine and a Narcan script. Okay. Tobacco cessation. First and foremost, I'm going to say medicine or procedure. We'll talk about procedures a little bit more down here. But let's say you've got nicotine dependence, and let's say your doctor has told you needed to stop smoking like yesterday because you're at risk from cardiovascular disease and other problems. You, my friend, need to stop smoking like now. And that means vaping as well. Anything that they tell you can't do on an airplane, that means don't do it. Don't do it. Okay, stop it. If you can't stop by yourself, no problem. There's more accountability and support, and there are medicines. Okay, over-the-counter medicines. There's the gum. There are the patches. Providers like myself can prescribe the Chantix or the Zyban. We can also get you TMS. TMS is transcranial magnetic stimulation. It's a helmet that is specifically for nicotine dependence. Yes, it's probably going to be out of pocket because most insurances don't cover that. But if you were just told that you just had a heart attack, right? And it was with the Widowmaker, you know what that is if they told you that. It's called a Widowmaker for a reason, because usually when people have that part of the heart muscle die, usually that's instantaneous and you don't come back from that. So if you've managed to survive that and they've told you stop smoking, well, maybe not run, but get yourself a consult while you're in the hospital to make sure that you start on medicines. And if the medicines don't seem like they're doing what they need to do, if you got to go the TMS route, hey, there's probably a provider around that can do it. Yes, we do it here in Maryland, and we help the tri-state area. So the DMV, the DC, Maryland, Virginia area. But if you're not in our area, please don't let that be a reason that you don't do it. Go look up TMS, all right? Look up TMS providers near me, okay? Most people have a machine that can do it. Brainsway machine already has a special helmet that you can use for it, but there are other devices that can do it as well, okay? So those are some of the main things I want to say, and I'll put TMS up here, because the third thing that I'm going to say, I'll move TMS off, because let's say it's not nicotine dependence or some other kind of dependence that you can use TMS for. If you need to go to more structured inpatient, is always an option. Rehab, always an option. And multi-day programs, okay? Those are always an option for all the things that I just said. Everything from the she Betty Fords all the way to people that will create individualized outpatient programs for you, where they're just working just with you and nobody else. Okay. These are options for you. I don't want you to feel like, oh, can't do this. Um, this can't be done. And I'm just going to die with this. No, 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 no. And like I said, none of these things are things that you have to be on forever and ever and ever. Um, for some people, they want to keep them because they feel like they need it. Antabuse, for example. Okay, disulfiram. Okay, fine. Naltrexone. Okay, fine. Buprenorphine for a time, plus or minus naltrexone. Again, okay, fine. But there are some people, particularly looking at nicotine dependence, where I've seen patients who will get on a good regimen. TMS is a great example of that. They'll get on their regimen after 20 to 36 treatments, just depending on which side of the research aisle you're on. You lose the craving. You no longer have to have that. You may need to come back the next year for a tune-up. That's it. Okay. I just wanted to remind people there is hope, there's healing, there are all these wonderful things. This is just my thought. I think in terms of threes, most of us do, but the accountability and support within the family, accountability outside of the family to minimize the enabling, support systems like the Addicts Anonymous, all the different ones, medicines, including treatments. TMS, I put up there because it's a non medication treatment. And then the programs, if you need a program. Some programs have all of this built in. There are some programs that have all of this, and that can be really good for you if that's what you need. Okay. All right. Well, I'm all done. I hope this has been helpful for you. If you have a person with a substance use disorder or any type of use disorder, even if it's that first part that I told you that, these are normally natural things that we need, like food and sex and homes. Well, if you start noticing, okay, I do have binge eating disorder, or I do have food addiction, there's a place for you. Sex, okay, normally sex will be okay, but if you're noticing that you're needing more and more partners, more and more different things, and it is an addiction, there's a place for you. Trust me, you're not the only one. Nothing new under the sun. Okay. There's hope, there's healing for you. And I will follow this up with a Bible verse because I know that there's one connected to it. I got excited. So before I joined, I did not look up my verse that I normally do. And I noticed it wasn't in the side, but there is one. There definitely is one over here. So we'll talk about that. And then tomorrow, I did see for LinkedIn, it had substance use disorder for tomorrow, but tomorrow is actually bipolar disorder. So LinkedIn, you'll be back in the fold when we talk about that. All right. You guys have a very blessed day on purpose. Bye bye, TikTok. And for those who are over here on LinkedIn and Facebook, love you guys. Bye bye. Take care.